Okay, our third speaker is Dr. Carlos Gadelha. Yes, from Industrial Complex and Innovation Research Group at the Oswaldo Cruz Foundation in Brazil. Please.
First, I'd like to thank Veronica. Where is she? Okay, well, hi, Veronica. No, it's really a pleasure to be here. Let me, what is happening? Okay. I have to present myself to let you know about the focus. I am economist, and I've been working in the academic area the last 30 years in Oswaldo Cruz Foundation, and also I participate in the policy implementation in the Ministry of Health and the other ministries to implement innovation strategy related to industrial policy, to health industrial policy. Then my focus will not be in biological aspects. If you have any doubt, please let me know. I answer after. And I will stimulate to think about the new business model and the new way to get the drugs and to get the products in the health field affordable for the people. This is my main focus, and I use Zika vaccine as an example of a systemic approach. Please, my English is not very good. Let me know if you have any problem to understand, because I can repeat and talk in an informal way with you. I will develop a systemic approach to innovation using the case of Oswaldo Cruz Foundation, that is the main institution, Brazilian institution in the health research. And we are in the first institution of Latin America in publication. And at the same time, we produce vaccines, biopharmaceuticals, diagnostic products, and establish a very huge partnership with the private sector. Then I think this experience, we are a public institution, this experience is not important only by itself, but to show some ways or to discuss some ways to face the huge problem of access. That's not only a Latin American problem, but a global problem. The conceptual perspective is that we need to articulate the political and social transformation with economic and innovation dynamics. They are not separate parts. We only can evolve in terms of economic innovation if politically and socially we are able to implement policy. For example, in the vaccine area, if you don't transform our vaccine system, you may develop the best vaccine of the world, but it will not have any impact. Then these are two sides of the same coin: the political and social transformation and the economic innovation dynamics. We must analyze it together, and fortunately, we have a period that could develop it in Brazil. We consider health in many aspects. First of all, health as a structuring factor of the social welfare state. Okay, it is very important. It's the point of departure. To talk about health, we are talking about the social welfare state. But at the same time, health is an important inducer of economic growth. It occupies the first position in the world in the innovation capability and innovation effort. Nowadays, it overcomes the defense area as the main area of innovation, and who does have a strategy to develop in health, maybe will probably be out of the fruits of the development for the future. At the same time, health nowadays has an increasing role in the international geopolitics and in sustainability perspective. And when you talk about health, we are talking about equality, you are talking about economic development, and you are talking about individual and social sustainability. Then it's a key component also of the sustainability. Then we are talking not only about health, but we are talking about development. Now, in the recent period, we adopt the perspective to think health about a productive system. It's impossible to think about vaccines, for example, Zika vaccines, without thinking how it will be adopted by the health service. It's in the translational perspective, the point, the questions involved in the health service must induce the research to vaccine. If not, we may develop a vaccine that will not be introduced in the health service. Then it's a system, a productive system that is interdependent. What is the key point I want to bring here? Without economical base, industrial, and it's not work. Without economic base that relate industry and services, our knowledge will be not transformed in social and economic development. Then we must look at the productive base that will transform knowledge in social and economic development. In our countries of Latin America, I'm obliged to tell you that it is the key problems we are facing. We don't have a sophisticated industrial base to transform knowledge in economic and social development. Oswaldo Cruz Foundation has a historical matrix. I will not give you all the details, but I have to tell you that the public health in Brazil is mixture with the trajectory of this institution. It was created in the beginning of the last century, and it was a key part of the development of Brazil. We adopted, I like very much to hear about the Pasteur model here. We adopted the Pasteur model since the beginning. We developed our activities focus on solving problems, structuring our innovation chain. Of course, with many problems, but problems is part of our worry and our business. In contemporary period, we develop the conception of the universal health system in partnership with other Brazilian institutions that established a universal health system in Brazil in 1988. At the same time, this perspective of health economic industrial complex. We act in the both sides of the development I was talking to you. These are only some photos of our trajectory, linking since the beginning the campaign against malaria, creating really the national states in the nation in a broad perspective in Brazil. We produced vaccines since 1937. This is the yellow fever. It was Rockefeller Foundation, the institution who transferred the technology to figures at that time. Then you have a very long tradition producing vaccine. There is a close connection with international science. Here is Einstein. He visited Cruz in the beginning of the last century, and Carlos Chagas, who discovered the Chagas disease, the mechanism of transmission and infection of Chagas disease. He received Einstein Cruz in the beginning of the last century. Cruz is spread in all the regions of Brazil in 11 national states. there is a huge international cooperation. I'm talking to you all of that not only to make propaganda, marketing, institutional marketing, but to tell you that when you think about a vaccine like Zika vaccine, we are dealing with a global market problem. It's not a country problem, a local problem, or a specific for some territory. To give you a strike example, in yellow fever vaccine, we offer the vaccine for 74 countries all around the world. The innovation chain was organized as a system in the institution, of course, with many problems that we must overcome. But we have to deal, and in dengue and in Zika experience, it was really impressive. We have to relate health and research and innovate, but not in only one direction as a linear process, but as a process that involves feedback mechanism all the time. This is translational research. If you don't do that, it's not translational research. It's a new name for the old paradigm. Zika initiatives, let me tell you. First, using our capacity in research, we could increase, we could aware an increase in microcephaly in the public health physician. It was our public system that could identify something different was happening. People that has Zika, woman that has Zika, develop, her son developed microcephaly. Then research, epidemiological research, established very strongly association between Zika and microcephaly. In 2019, Brazil declared national public health emergency, and the next year, the beginning of 2016, WHO declared a public health emergency concern. It is very interesting that it was epidemiological research, not a biological research, that first identified the causality. It is very impressive, using case control studies. After that, we discover, using biomedical research, the mechanism and of course, in a network. It's not a work done only by one institution. But what is impressive is it was the contact with the physician in the field, in the primary health care, that gave the signals that was used by epidemiologists to establish the relationship between Zika and the microcephaly. After that, it was established a very huge program for research, public policy, and production in different areas. Here is only to some illustration to let you know that the problem was identified in the primary care by our universal health system. These are the epidemiological studies that involved many regions in Brazil, utilizing multicentric cohort studies and case control methodology. After that, the mechanism of transmission was established, also involved biomedical research, and we initiate innovation program that involved 3 areas: vaccine development, vector control, and the diagnosis. It's very important to say I am economist, but I don't like very much health economics. Okay? because many times you select what is the most cost-effective way of doing things. In innovation area, we must attack the problem in different ways because you don't know what will be the best decision. We don't know. We are ignorant about the future. Then we must, HIV show us it. You can't put all your bets in only one option. Then we open 3 kinds of development: vaccine, vector control, and diagnosis. I will talk to you here only a little about vaccine development, but I'm obliged to tell you that but many aspects involved in the Zika problem was being attacked by our innovation policy. We established a stronger partnership, internal in Brazil, international partnership, and with public and private companies. Some projects, some vaccine projects I want to show you very briefly. First, vaccine using attenuated vaccine that using the same base as yellow fever. Because it's a family of flavivirus that seems a good point of the pathogen. These are in preclinical studies, and it has the involvement of the Ministry of Health. Second, a process involving inactivate Zika vaccine. Let me return. For example, why we need a systemic approach considering the use of vaccine. You can't give for a mother an attenuated vaccine that can establish or can induce some damage for the baby. Then we must consider what will be the demand, what will be the resistance, what will be the way to deal with the real situation to apply an innovation, to apply a product. Then the second platform we are developing is inactivated Zika vaccine. There is also a synergy with research and development of yellow fever vaccine. It is, in principle, superior than the attenuated vaccine, okay? And it was applied directly to the development of the inactivated Zika vaccine. Okay, this platform of yellow fever could be applied directly. That is why it's so important to work not only in products but work in technological platform. When you learn about one product, you can use this learning for other products. Another platform where we are concentrate our effort is a recombinant vaccine. It is in the initial level of development, but the results are promising. Finally, these are only the 4 main examples I bring here to show you. DNA vaccine against Zika. It is already in the clinical stage. It is being applied in 15 to 35 people in the region of Belo Horizonte, in Minas Gerais, Brazilian states, and it is already being tested in humans in interaction with NIH of the United States. The perspective we are working on is to integrate our universal access, because, for example, many people are talking about developing 5, 6 vaccines for different groups. It is very difficult to deal with that. No vaccine in Brazil, you produce different vaccines for different groups. When you adopt it, considering a universal strategy, it's much better to develop a vaccine that you can apply for the whole population that need it. Then we articulate the universal, our universal access perspective with the scientific and technological capacity and with the productive capacity. I'd like to have a dialogue with you that in Latin America, we must produce in health. We can be completely dependent to import health products and produce soybeans and iron and oil. It will not be developed if you have this option. Then it is under this strategy to consider that to be more developed, we must enter in the knowledge society. It is unacceptable to be out of the knowledge society. I have some data, unfortunately I couldn't bring here, that countries that has the productive structure more developed, in general, they are more equal. Okay, they aren't two different problems. A country that is based only in natural resource will be an unequal country. This is our political perspective. The systemic approach also involves, I like very much to listen you about the regulation, but I'd like to introduce it in the systemic perspective that you must dialogue our science and technology capability with our production, with health technological assessment and incorporation. It is not only one incorporation regulatory decision. We have two decisions for the universal system, as you have in UK, for example. You must be approved in terms of safety and in terms of efficacy, but we also approve the use for the population for the product be able to be bought by the public by the public system. Then we must establish a science, technology, and innovation strategy, considering how it will be adopted by the universal health system. Then these three parts are essential to achieve our main objective, that is to deal and to supply health care for the people. Maybe this is the main message I'd like to bring here. How to use our market. How to use our market. Will you be only market, or you use our market for the development? This is the key question I want to, and this applies for United States, for Europe, for developed countries. You have a huge market in the health field, between 10 and 20% of GDP. It depends on the countries. In Brazil, it's around 8 to 9% of GDP. We can use the market, for example, from the Ministry of Health, to buy products without considering anything about development, technology, innovation, science and technology. In Brazil, since 2009, we begin to use the market to induce technological development and partnership with private companies. Oswaldo Cruz Foundation has a long history of partnership with private companies, but not only to buy products, but to interact in the technological development. This is the last slide. Then we changed our law to permit to buy products using technological orders from public institutions that interact with private companies. What I ask you for us to debate, if it could be a model to introduce Zika vaccine not only in Brazil, but in a global health perspective and in Latin America health perspective. Our base to to think about a global health action involve this articulation between national universal health system with national science and technology innovation system to create an atmosphere to link innovation for universal access. This is the key message I want to pass you, and you may discuss it during after this time. Thank you very much.